Now, this Saturday is World Stroke Awareness Day.
Joining us to talk about the signs and what we need to know, please welcome OU Health's Dr. Hakeem Shakir, a neurosurgeon. Thanks for talking to us.
Good morning. Thanks for having me.
This is a big talker because the signs and symptoms, what to watch for, is the biggest thing with strokes. So you have an acronym that helps people identify that. Kind of walk us through that.
Absolutely. So every 40 seconds, someone is having a stroke.
Oh, wow.
And it's important for people to recognize the signs and symptoms. And the acronym is B FAST.
Okay.
So B for balance or unsteadiness, E for eyes if there's problems with vision or blindness in the eye suddenly, F for facial droop. So if one side of the face is drooping, that's a concern. A, correct.
Which is B FAST, B-F-A, facial, A.
Arm.
Arm, yeah, I'm like, I know the A, what's the A? Arm, if it droops, kind of?
Arm weakness, that's right.
Okay.
And speech, S for speech, and T, the last one, is for time. So if you're seeing anybody having these symptoms, it's imperative to call 911 and get them to the emergency department.
So that's what I was going to ask. I mean, is there anything other than just calling 911 that folks should do, or just that's the top priority?
I mean, that is the priority, because we have a saying that time is brain. So every minute that is lost while somebody's having a stroke, millions and millions of neurons are dying. So it is, again, imperative for the patient to get to a facility, a comprehensive stroke center, where providers can take care of them.
What actually is a stroke? What is happening when a stroke happens?
Great question. So a stroke is a disruption of blood flow to the brain tissue. So there's two kinds of strokes. There's the kind where there's a blockage and blood can't get to a part of the brain, or there's a hemorrhagic stroke where blood vessel breaks or bursts, and that blood damages the brain tissue. The majority of strokes are predominantly ischemic, or where there's a blockage, and those are the types of strokes that we can help with both types of strokes, but yes, those are the types of strokes.
Go ahead.
You know, we know that most strokes happen in folks over 65, but they can happen at any age, really. Is there anything that makes younger folks more susceptible to that?
Yes, so lifestyle, right? So people who smoke cigarettes, have uncontrolled blood pressure, illegal drug use, obesity, those are a number of things that can lead to having a stroke. The easiest and most modifiable risk factor, which we talk about, something that you can change and control, is hypertension or high blood pressure. So we really impress upon patients to get established with primary care physicians, get your blood drawn, get a workup, and prevent the possibility of having a stroke.
Yeah, stay on top of things. Did the pandemic make numbers go up in strokes at all? Did you notice?
So in some cases, yes, because we suspect that the COVID-19 virus made people's blood a little bit more sticky at times. So an inflammatory process. So we noticed that people were more predisposed to having clots.
Yeah, okay.
And that could lead to clots developing in the brain.
Wow. Where can people go for more information, or just to kind of go over the bits of advice you just gave us?
So Google's always a good place to start, but you can go to the OU Health website. The American Heart Association is another great place to stop by and get information regarding World Stroke Day and preventative tips.
Yeah, absolutely. Be fast. Got to remember that acronym.
And don't forget the A like I did.
Yeah, that's okay. You did great. That was his first live interview. You nailed it. Great job, Dr. Hakeem Shakir. We appreciate you.
Thanks, sir.